Thank you for giving us the opportunity to present our data. In plasma cell disorders, clonal plasma cells produce either kappa or lambda light chains that are not associated with heavy chain. We have previously described an antibody called Kappa-Mab that binds to a surface kappa myeloma antigen, KMA, and a phase 2b clinical trial was recently completed. Today we describe two antibodies that bind to specific conformational epitopes in the constant region of a surface-expressed lambda myeloma antigen called LMA. The 10b3 and 7f11 antibodies bind specifically to LMA. We examined human myeloma cell lines and fresh bone marrow samples from 65 patients with plasma cell dyscrasias using flow cytometry. For fresh samples, we identified plasma cells by their expression of CD45, CD38, and CD138, and then examined their expression for KMA and LMA, BCMA and CD56. Antigen density of KMA and LMA was compared with BCMA using QuantiBrite beads. We also used chromogenic immunohistochemistry to detect the expression of LMA on sections of frozen myeloma and normal human tissues. The constant region of the lambda light chain has 4 distinct isotypes. This slide shows the binding profile of 10b3 and 7f11 antibodies and of Kappa-Mab to 3 myeloma cell lines expressing different lambda constant region isotypes. 10b3 antibody shown in orange binds cell lines expressing lambda 1, 2, and 3, while 7f11 in purple binds only the lambda 2 and 3 expressing cell lines. Neither antibody binds to KMA expressing cell line JJ and 3, whereas Kappa-Mab does, shown in blue. Bone marrows from 65 patients were stained with either Kappa-Mab or the 10b3 antibody along with BCMA. As shown in the orange boxes, there was enrichment of KMA staining in patients with relapse refractory kappa myeloma, in whom 10 of 11 cases were positive. 2 of 4 lambda relapse refractory lambda myeloma cases were also positive for 10b3 staining, and all 3 cases of amyloidosis expressed LMA. In comparison, only 1 case was positive for BCMA. There was no consistent correlation between the expression of either KMA or LMA and BCMA. Representative flow plots from 2 relapse refractory myelomas are shown in the slide, in which the black dots show gated clonal plasma cells. Both patients were receiving lenalidomide. The 3 KMA panels on the left show a kappa myeloma patient with less than 0.1% plasma cells in the marrow. The blue box in the top left panel A shows KMA expression was variable with both negative and strongly positive plasma cell populations. CD269 or BCMA was negative, as shown by the absence of cells in the green boxes in the 2 left panels A and B. In the bottom right panel C, cells expressing CD56 can be seen in the red box. On the right, LMA plots from a patient with lambda myeloma are shown. As shown in the orange box in panel A, 10b3 staining varies from negative to strong. Unlike KMA, the clonal cells also express BCMA, as shown in the green box in panel B. However, the BCMA staining is lower than that of LMA. The red box in the bottom right panel C shows that the cells do not express CD56. We used chromogenic immunohistochemistry to determine whether LMA could be detected in myeloma and normal human tissues. Histological specimens were snap frozen to preserve the lambda constant region conformational epitope and were stained with 10b3 FITC. The top left panel shows abundant diffuse, most membranous staining of a plasmacytoma in the lung, but not in normal lung in the panel below. The panels to the right show positive staining of occasional mononuclear cells in normal tissue, such as colon mucosa, ileum mucosa, tonsils, and lymph node, and non-specific staining in normal bone marrow. These findings indicate that LMA-positive cells are occasionally found in normal secondary lymphoid tissues. In conclusion, 10b3 and 7f11 antibodies specifically recognize LMA and bind to a conformational epitope in the lambda constant region. The expression of KMA and LMA appears enriched on plasma cells from patients with relapse refractory myeloma and are not strongly correlated with the expression of BCMA or CD56. LMA and KMA are expressed on clonal plasma cells in patients with plasma cell disorders and on a small number of cells within normal secondary lymphoid tissues. Our data suggests that the 10b3 antibody has the potential to specifically target LMA-positive plasma cells in the majority of lambda-restricted myeloma and amyloidosis. Thank you for your attention, and I'd be happy to answer any questions.